Hey, everybody.
Note of
So,
optimism.
Dr.
I think it might be
Fauci
useful
has
to
been
talk through
pretty much locked out of the mainstream
the
media, right?
process
But
of
the
getting
mainstream
a
media
vaccine,
isn't what it
both so
used to
that
be.
people have some sense of what it takes to
Look.
get from an initial candidate to something that's ready to go. But also because, while I know that the vast majority of people would be very
This is live. Mark
excited and
Zuckerberg
optimistic
has
if they could get a
Dr.
vaccine,
Fauci on,
that would
and
prevent
at
them
any
from
one
getting
time,
COVID
over
today.
100,000 people are watching.
I know that there's
At
some
any
people,
one
it's
time, which will
fringe,
add
but
up
it's
to several, many millions of people seeing this
question the overwhelming
Facebook broadcast. This is
scientific
incredible.
evidence on the
And then I
safety
took this from Facebook to my phone and
of
put it on
these.
my
So
Google
I just
Nest
think
kitchen app.
going through the
I should say our
process
Google
and
Nest
showing
kitchen
how
app here.
overwhelmingly
So you can
focused
watch it
on
here.
making sure that these
This is
vaccines
great.
are safe.
This is not going to be
helpful
Russia.
to go through as well.
This is not going to be Russia.
Very
No
good.
way.
I'll do it succinctly. Well, you get a candidate like the one we did. You get it. You put it in the form to be administered, and you put it through animal studies, animal tox studies, animal efficacy studies. So before you even think about going into a phase 1 in humans, you got to have, is there a reason to believe that this is going to induce a response? You got to see it induced in an animal before you see it induced in a human. And does it protect in disease in an animal? Then you get that candidate and you go into phase 1. Very limited number of people. Our phase 1 had 45 people, 15 at each dose. You want to see, is there any immediate safety signals? And you want to see if it induces the kind of response that you would predict would be protected. Then you go to the next phase. So if phase 1 is 45 people, phase 2 is hundreds of people. You get there, you continue safety, you continue immunogenicity. If it looks good, you then move to phase 3. Phase 3 goes from hundreds of people to thousands of people. The trial we're going to start at the end of July is going to involve 30,000 people. So when you have that many people in a trial, not only are you looking to see if it works, but you're constantly keeping your eye on safety to make sure that a vaccine actually doesn't enhance disease and make people work. Once you do that, at every given point in the trial, an independent group called the Data and Safety Monitoring Board looks at the data and says, trial's going okay, you can continue. Looks next month or the month later, trial's going okay, you continue. Or, wait a minute, it looks like you're never going to really get an answer because nothing looks like it's working. You have futility, stop the trial. Or what we're hoping for, Mark, that they look at the data and say, wow, this looks good enough that ethically you can't continue with a placebo. You've got to say this works, let's start distributing it. Those are the individual steps of developing a vaccine.
Okay, that's very helpful to go through. While we're on kind of the basic safety measures for some of the common sense things that we're hoping to roll out.
Check this out on Facebook and subscribe to Zenny62 on YouTube and bookmark opennewsnow.com. And thanks, Mark Zuckerberg, very much.